Hey everybody, Judy Seeger here, back with the next episode of the Ozone Summit. And in this particular interview, we have one of the top experts in ozone therapy, world-renowned Dr. Howard Robbins. Thank you so much for being on here today.
It is my pleasure to be here with you, Judy. Thank you for having me.
Yeah, I'm very, very excited. I didn't know about your work, but as we've been chatting before this interview, I have learned so much, and I'm very excited that everybody else gets to hear about it as well. So first off, let me just say to all our viewers that thank you for your time for being on here. You're in for a treat with Dr. Howard Robbins, where he is going to really go into a lot of details because he has been doing this since 1973. Is that correct, Doc?
No, intravenous ozone since 1990.
Okay, 1990, but you have been a practitioner then since 1973.
Oh, yes.
Uh-huh. Oh, yeah. And then you have also given me another number, which is quite impressive, is that you have done over 265,000 ozone treatments. Is that correct?
That is absolutely correct over the last 28 years.
Wow, that's a lot.
45,000 what they call major autohemotherapies, and over 235,000 what we call now Robbins method of direct intravenous ozone therapy.
Right. So there's some things that you've created that have been really interesting in both my world as far as the practitioner side, but people need to hear about it. So I'm excited to dive into that. Also, to dispel some of the myths about using ozone with vitamin C IV. I'm excited to jump into that. That's going to be great. So first off, Doc, just want you to explain a little bit about yourself and what kind of work you do.
Well, I started out teaching, doing traditional medicine, what we call traditional in this country, and teaching foot surgery, actually. And then I met up with a man by the name of Gary Knoll, who turned me into what we then called natural medicine, then holistic, complementary, integrative, and now we call functional medicine. And I've been doing that since 1977. In essence, what to do to avoid medicine injections and surgery and still get a person well. And then 1989, we started doing intravenous vitamin C and intravenous chelation therapy. And in 1990, I went to see a buddy of mine, Dr. Bobby Atkins, Robert Atkins, the diet doctor who passed away. And I walk in one day and he goes, "Robbins, you got to start doing this ozone therapy. It's the greatest thing. You got to start doing it," right? And that was in November of '89. And in January of 1990, we began doing direct IV ozone along with our other intravenous treatments.
So was it that the other docs were encouraging you and you were being exposed to it, or was there something about ozone therapy that made you think, I have to use that? What was it that made you switch and get that into your clinic?
Well, it was very simple. I had a very close relationship with Dr. Atkins. We were very good friends. And when he told me something was amazing and I should add it on to my practice, I just went and took his word for it. Very successful man at that point in his career. And bottom of it all was, once we started using it, it only took us a few years to see its amazing advantages. And we weren't even using the best method then. We were using a method that I now think of as an antiquated method, though it's used predominantly in Europe and around the US, where you take out the blood, you ozonate it and put it back in under normal pressure, meaning that, we're living in what we call 1 atmosphere of pressure. That's what's in the room around us right now. So imagine going to the blood bank and giving, a unit of blood and then having to go to the hospital and getting a blood transfusion. And that's what we did. We would take out your blood, ozonate it, and put it back in. And that was called major autohemotherapy. But then we transitioned into a much simpler method, a much safer method in the long run, called direct IV ozone, where we push the oxygen ozone gas directly in. And over the years, I pioneered on how to do it really safely, which is very important here in New York. You're allowed to kill patients with pharmaceuticals, but hurt one person with ozone, you're out of business. And we've been doing it for a long time.
Well, we could talk about that for a long time too, right? Okay, so we are going to jump into all those applications you just mentioned and what you developed and all that. But first off, let's start out with the basics. In your own words, Doc, how would you describe what is ozone therapy?
Okay. Medical ozone therapy very simply uses an element, really, ozone, O3, which is made at that moment in time from O2, medical grade oxygen, which makes it unpatentable, which is why Big Pharma doesn't have any need or use for it here in this country. Put aside that it might get rid of the need for a large amount of antibiotics and other pharmaceuticals, it's that they can't patent it, so they don't have any need to pay for research in this country, while research around the world is voluminous. I mean, there's hundreds of research articles that get published in our National Library of Medicine, PubMed, every year. New ones are coming out, 80 or more every year you'll see there. But here, it's all basically most doctors and patients don't know about it for that reason only. There's no conspiracy. It's just that there's nothing in it for them. So medical ozone, basically, it's a gas, not a liquid. And when the gas reaches virus, fungus, yeast, mold, bacteria, parasites, toxins, harmful free radicals, it'll destroy them because they can't resist it. It'll actually even chelate toxic metal off nerve tissue, which regular chelation therapy can't do.
Okay, hold on. What is chelation? What did you just say about chelate?
Well, chelation actually it's a word in Latin. To chelate means to chlor onto. And chelation therapy has been used for a number of things, but basically to remove toxic metals from your blood and from the cells that they may be stored in. Lead, mercury, aluminum, arsenic, just to name some of the many metals that our bodies are being harmed by. And nothing else will take them out except that when it attaches to nerve tissue, which is where they do all their damage.
So you're saying chelation with ozone would be a great combination?
Yes, because now with regular EDTA chelation therapy, you can clean the blood and the cells out rapidly of these metals and then get it off the nerve tissue where they'll do the real damage when they're left in your body. And that's what regular chelation therapy can't do. So the combination made our clinic years ago a very unique clinic in its benefits to people.
Wow, that's really huge right there, because a lot of our viewers have had the amalgams removed from their teeth and going through trying to figure out what's the best way to chelate then all the toxins from their teeth, and they don't know, and they're going to biological dentists, and some of them know, some of them don't know about using ozone therapy. So that's a very valuable topic right there. But I want to just go into the basics, right? So what have you been seeing right from the start, it looks like, the benefits, and if you give us some examples, but what are the main benefits you see when people start using ozone? And you might want to share with the viewers too, what kind of patients you typically get in so they know what you're dealing with, right?
Well, I always like to start off by saying after 28 years and over 265,000 treatments, we've only had what I call 8 adverse reactions. That's very important to people.
That's huge.
How it's going to hurt me? Doctor, do no harm. And in all these years, thousands of patients, hundreds of thousands of treatments, 8 patients, 4 of the patients actually deep in the therapy, 40, 50, 70 or more treatments in, developed a temporary rash, so I stopped treating them. Now, while we both know they may have just been purging something, it may not have been a true allergy sensitivity reaction to the ozone. In New York, you just can't take a chance, so we stopped treating those people. Everybody needs me to stay in business, and I have to go to sleep at night, so we don't take any risks at all. But there are many side effects to ozone, and if you need the side effects, then I call them primary effects. So basically, ozone, as I pointed out, will destroy almost every infectious disease there is. As long as it wasn't made in a military laboratory as a weapon of mass destruction, we can pretty much destroy every virus, fungus, yeast, mold, bacteria, parasite, and toxin. And that's very important because traditional medicine has no answers for some of these things. There are no answers for viruses. There's absolutely none whatsoever. Antibiotics are causing more trouble than they're worth. with all sorts of reactions to the antibiotics that we're often treating. For example, muscle aches and pains from the quinolones, where people have lost use of their muscles. And we've had some great results with that. But the bottom of it all is people come to us with what I call infectious disease, all right? Or they come to us with what I call conditions and diseases that won't kill you, but may make you wish you were dead. For example, diabetic problems, rheumatoid arthritis, the autoimmune diseases, and stuff like that. And that's what ozone is amazingly beneficial in eliminating. And I always like to, preface everything I'm going to say that morally, ethically, and honorably, no doctor should ever promise or guarantee a result. Even if we've been successful 10,000 patients in a row, who knows what's going to happen on 10,001 for some reason. But having said that, we have had amazing results with diseases and conditions that, in some cases, no one in the world has ever had any success with. Example. Chronic regional pain syndrome, CRPS, used to be called reflex sympathetic dystrophy, RSD. 1.5 million Americans suffer from it. Now, most of the listeners don't even know what that is. The ones that do are now listening up. Reflex sympathetic dystrophy, now called CRPS 1 and 2, is a painful disorder that comes on after an accident or a surgery. For no reason at all, apparently no reason at all, instead of that body part healing like it should, it becomes burningly painful. That burning pain can stay in one limb, or it can spread around the whole body from nose to your toes and cause pain that is almost unimaginable that people can endure. And we have been able to, in all the cases we've seen, improve it dramatically, and in some of the cases eliminate it completely, which is kind of amazing. No one in the world has been able to publish any real benefits for it, but we've been able to accomplish that. Then we've had recent success, amazing success, with Lou Gehrig's disease, amyotrophic lateral sclerosis. We've taken them out of, I don't know if you saw the movie The Theory of Everything, where the guy is all paralyzed and he's, all bent and twisted and can't move, in spastic paralysis. Well, in that movie, and was an Academy Award-winning movie. Well, we've been able to take people out of spastic paralysis. We've been able to get motion back again, giving them the ability to breathe on their own again. And of course, you can't just say these things. I've got video documented evidence to prove this kind of thing. Lyme disease, probably the most serious infection around the world, that is the most underrated, underdiagnosed infection when it attacks all the different parts of your body, and it's often misdiagnosed for things that people don't even know. They're told they have heart trouble or lung problems or whatever, and it's really Lyme. And the reason they're having trouble is because the testing is so poor. The Lyme literate doctors will tell you a positive test means you have it, but a negative test doesn't mean you don't. 1 out of every 2 to 3 new patients is a late-stage Lyme patient now, where the antibiotics didn't work on them, or maybe it put them in remission, and now they're coming out of remission and the antibiotics won't work again because they developed a resistance to it, which you can't do with ozone. So that's what we see. Herpes patients. Herpes has become probably the most social, psychological, possibly even spiritual infection that has changed people's lives in ways you can't imagine. I've seen marriages end over it, divorces, engagements end over it. People come in and cry from beginning to the end of their consultation because they just can't live with this anymore, and the way it's affecting their lives. And fact is, ozone, it's a hard virus to get rid of, but ozone is able to destroy all viruses. So if you stay with the therapy long enough, you will win with almost anything that you have wrong with your body.
Right. So hold on. So we could go through every disease, and I know you have experience in so many of them, but I want to finish up with the basics here so people understand it, so they know that it's a good fit for them at where they are in their healing journey. Yeah. So one of the things is they often question is, first, how does it work in the body to kill a virus? Like, they've never heard of this, and why aren't their doctors using it? And how safe have you found it? I mean, you have said that out of the hundreds of thousands of people you work with, that only 8 had side effects that were adverse, and that was just 4 out of them that were rashes. So people need to understand that, you know, it's minuscule, that, you know, the side effects, but we do want to cover it to make sure they understand how safe it is and if it's a good fit for them.
Okay. Well, first of all, you can keep it real. I like to keep everything very simple, and it's not complicated here. Ozone is, as a molecule, is missing an electron. So what it does very simply is it steals an electron from anything that can't resist it. Now, our healthy cells develop antioxidant enzymes that protect us against ozone damaging our healthy cells. Superoxide dismutase, glutathione reductase, glutathione peroxidase, and catalase. And that's why I don't kill people. I only kill things that don't belong in the body, because they can't manufacture these antioxidant enzymes that are powerful against ozone. Now, side effects, I said sometimes you want them. Hair and nails grow longer, stronger, healthier, and faster. Skin takes on a healthier look because it gets rid of all sorts of skin problems. People fall asleep easier, sleep better, need less sleep. More energy all day long, that's a biggie. More stamina and endurance, great workout in the gym. We treat athletes who go right out for a workout and have a tremendous workout session afterwards with no extra effort. It acts as a painkiller, an anti-inflammatory. It has many circulation benefits, making the red blood cells rounder, so they flow smoother, easier, less viscous, more flexible so they can slip through narrowed and clogged arteries better. And it melts down calcified plaques in the blood, opening up the circulation. One of its biggest things that are being researched now, predominantly in Europe, but we see the effects here with what we do, is that it seems to stimulate the body to make abundant amounts of natural stem cells. And that probably accounts for why we often do what I call repair the unrepairable and fix the unfixable. And we see things that just shouldn't happen or couldn't happen.
So it sounds like a magic therapy, and we know it's not, but it sure sounds like it, right?
Just medicine. It's just medicine, and it's been overlooked in this country. But interesting, in 1885, Dr. Charles Kenworthy, an MD from Florida, your state, wrote a monograph called Ozone in Medicine, published in 1885. So ozone was used intravenously in the direct IV method as early as then, and up until the FDA came into being and drugs came into being around the late 1930s, 1938, we had penicillin, and that's when the drug companies took over our country, and ozone disappeared. Became very important in Europe after World War II, and that's why it's so well studied there, because they didn't have money for medicine. So they needed something to treat all the burns, the wounds, the infections that occurred after the war. And this was the answer because it was inexpensive, relatively speaking, to perform.
That's awesome. So people need to understand the wide variety of applications, but let's talk about the way you apply it, because you use the typical ways that we hear about, like the MAH or the injection, but let's talk about some of the other things. Well, let's go through the basics of how the applications are used and then how you use it, because you use a little bit different than everybody else.
Well, worldwide, there are actually 7. Intravenous ozone therapy is the most powerful way to use the medicine because you're getting something into the blood right away. Now, there are 7 different ways that can be done worldwide. Only 6 are permitted in the United States. Of the 6 that are permitted in the United States, I've done 4 of the 6, and only 2 of the 6 actually have the empowerment, the power to really destroy things in the body that don't belong there. So my patients aren't coming to me to get better. They're coming to me to get rid of their problems permanently, completely, once and for all. So we turn to the methods that would be able to accomplish that. After my first 5 years and doing over 45,000 of those major autohemotherapies that I described, we found out what's known worldwide about it, even by the expert. helps almost every condition, but it doesn't get rid of them unless you have a miracle take place. And I want my patients just want to get rid of their problems. So we turned to the direct IV method and perfected a way of doing it that we now call Robin's method of direct intravenous ozone, because my protocols take into account that you're not the same as everybody else. You're an individual. And I may have to adjust this almost every visit for you to make it more comfortable for you to get rid of your problems and at the same time be effective enough to eliminate it as quickly as possible. Different people, different body sizes, different medical problems. We want to prevent having Herxheimer reactions and things like that. So we have to adjust the medicine for the individuals, and my protocols and the Robbins method takes that into consideration, allowing for that minute adjustments, micro adjustments, as well as macro adjustments to get people well as fast as possible. And then just that required 3 or 4 treatments a week. For most of my career, that's what we did. And we found that would be effective with almost everyone. Not with everyone. Some people needed more medicine. With that in mind, after Dr. Rowan and I came back from Sierra Leone with successful treatment for Ebola, we came up with a protocol that seems to work now. We call it Robbins Fast Track. This is where you can do 2 or more treatments a day, 6 days a week, with the idea being kill, 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 and things don't have a chance to regrow, regenerate, and duplicate. And that's how I'm able to get people over conditions and diseases that they've had for years in a very rapid way, provided their body says it's okay. We're not the boss, their body's the boss. And by speaking to us, it tells us, okay, full speed ahead, or doc, I need a little bit more gentle. Adjust it for me as the individual. And that's what we do.
I love that. It's not a one size fits all, and people need to get their head out of the sand to think that there is. It's not like that. And you're a true healer, Doc, and I really appreciate that in you. I have a big...
I just want to finish answering your question. So there are 2 other methods that that have real benefits. Well, we have the direct IV method, and then there was a method that was used for the last 30 years, 25 of them worldwide, requiring special German machines and training, called, very big long name, hyperbaric high dose ozone therapy. So it's sort of a combination of both direct IV and the MAH. What happens is, they're using a special German machine. We're able to take the blood out as if we're going to give blood to the blood bank, but not in a half hour that it might normally take, but in only about 2 minutes under vacuum pressure into the glass collection bottle. Then we ozonate it with a huge amount of ozone and oxygen gas, and then hyperbarically, you're not in a chamber of any kind. The machine pushes pressure with the oxygen and ozone gas into the glass container, and that pushes the blood back into your vein very rapidly. That whole process takes about 5 minutes. Then Dr. Johann Lahadny from Austria, about 5 or 6 years ago now that we know of, came up with the idea, well, why stop with just that one treatment? How about repeating it without stopping on that same session 9 more times? So you get 10 passes, as we call each of those in and outs, in one session if possible, and that puts humongous amounts of ozone in medicine into your body, and what it does is it speeds up the healing. The only deficit there is that requires you have big veins. You can't do it with little itty bitty veins. Now, I did an independent study, so you'll understand. I used 149 of my patients responded to the study, the questionnaire, and we found out that in terms of just vein size, anywhere from 6 to 7 out of every 10 patients had veins that were too small for either MAH or the hyperbaric method, where you need a blood needle to do that, a much bigger gauge needle. Whereas with the direct IV, We're using 27 gauge butterfly scalp vein sets that you use on newborn and premature babies. When you need an IV, they only have veins in their scalp, and these are the needles that they use to give them the IV. So we're able to get extremely small veins, which expands the number of people that we can treat to almost virtually everyone.
That's really huge. So the 10 pass, some people are starting to hear about it, very few yet, but that is a great way to get them started. It's kind of like a jump start, actually, to get them going. Now, one story that I want to go back to that is really a phenomenal story is when you and Dr. Rowan, we do have him on the summit. We have an interview with him already. We want you to share, because he didn't share it, so we're saving it for you. When you were in Sierra Leone with Dr. Rowan, and you guys were dealing with the Ebola virus and what the details were there. He touched on it a little bit, but I want you to go in depth on what happened and what can ozone therapy do for some, because Ebola virus is really crazy strong virus, and it was just eating people up. And so for you guys to even go in there, that's guts right there, right? So tell us the story about that.
Okay, so very quickly, Rowan calls me in July of 2014 and says, Robbins, we got to go to Sierra Leone to treat people with...
That's a friend. Hey, let's go into the war zone.
And I immediately said to him, are you out of your mind? And I hung up on him. And this is a true story. I called him back 2 minutes later. I said, Robert, if you think you're going to go there and use my method of ozone and get all the fame and glory without me, you're out of your mind. I'm going with you. And then through Rotary, and because I'm a Rotarian, and through other connections we made, we were able to get an invitation from Dr. Ernest Bai Koroma, the president of Sierra Leone, inviting us to come and train their doctors. So we weren't invited to treat people, we were invited to train doctors. And over the course of the week that we were there, we trained over 90 doctors and healthcare professionals in the method. Now, when it was supposed to be used for the first time now, after meeting with the president, and I treated him in his home myself, and then meeting with the actual Minister of Defense, who is the Ebola czar now in Sierra Leone, they only wanted us to go right in and do it. But we were having problems with the Minister of Health. So when we got to the clinic, none of the doctors we trained that were going to do the therapy were there. Surprised. So we talked to all the doctors and healthcare workers there about it. They line up to get the therapy, and a call comes from the Minister of Health that says, if you do the ozone therapy or you get the ozone therapy, you're going to lose your job. This is a very poor country. You have no idea how poor. It's truly third world. So that was the end of it. We left disappointed and dejected.
So you never work with anybody who actually had the Ebola virus. You were training the docs.
There is some good results here, some positive things. So we leave with our tails between our legs and are sad and dejected. And then 4 of the doctors working in the Ebola Center for Sierra Leone came down with the infection. And one of the doctors that we trained, actually 1 or 2 of them that we trained, had to sneak in the ozone therapy, because it's made from a machine from a distance away from the clinic so they wouldn't see it, carrying it in ice water, the syringes filled with, in ice water so no one would see or know what it was, gave the doctors the treatment. Now, here you have a disease that has over a 65% death rate within 10 days, okay? And if you do survive, well, then you survive, but 65 out of 100 people will die within 10 days of getting it. All 4 doctors, within 2 treatments a day for just 2 days, had no more Ebola. So we figured out why. It's pretty much science. What makes the Ebola virus so deadly is that the entire virus is coated with these sulfhydryl groups. It's chemical that has a marked attraction, like a glue for our cells. And when it gets into our cells, it glues itself in. And just imagine the whole surface is coated in glue. So once it gets in your body and it touches a cell, it gets in there and duplicates. Well, what makes it so deadly, God gave us a way of destroying it, ozone. That's what makes it so susceptible to ozone. Ozone grabs onto those groups, attaches and destroys them, punching holes in the virus, allowing the ozone to get into the inner core of the virus cell and destroy it. So it became probably the easiest virus we ever came across to destroy, and that's what led to what we used to call Robin's round the clock. We thought we were going to have to treat them every 3 hours around the clock to save their life. Turned out 2 treatments a day for 2 days, gone. Then there's an interesting...
Wait a minute, 2 treatments a day for 2 days, and Ebola virus is gone?
They went back to work. Now,
wow.
A 5th patient...
That's a wow.
And we published in August of 2016 in the African Journal of Infectious Disease. Okay? But we only found out this past November what may have actually happened. Now, again, this is secondhand, but it's believable because of the sources it came from. I trained one of the leading dentists in ozone and dentistry from South Africa this past November. And what the doctor told me, because he's in the in with all the big shots down in Africa, and particularly in South Africa, is what occurred. According to one of his close friends, who's an official in WHO, the World Health Organization, here's what occurred. Big Pharma, because the whole country knew from our TV appearances in Sierra Leone all about ozone. They were all excited to get it. What happened was Big Pharma found out about it, supposedly, this is again told to me secondhand, and contacted WHO. WHO was told that Big Pharma is pulling all their funding out of WHO if they allow ozone therapy. WHO contacted the Minister of Health in Sierra Leone and said, you're going to lose all your funding from the WHO if you allow ozone therapy. And that is why that morning that we went in to have the therapy performed, the call came through. If you do it, you'll lose your job. It was the only way they could bypass the Minister of Health, Paulo Conte, and the Minister of Defense, Paulo Conte, the Ebola czar, and the president's decree that it should be performed. So he couldn't stop the therapy, but he could stop people from doing it. And that's the story.
That's really sad though, right? That's just, and it happens all the time. It's not just Ebola, but that happens all the time, all over the world. And yeah, it's a very sad story that the government is not really there for the people many times for their health or for their well-being. They're supposed to be there to protect us, but they don't. But that's another show.
Oh, yeah. another series.
Woo, that would be like that's a series for sure. I could go on about that all day as well. Doc, just to, as the time is winding down, I want to do some myth busting here, and you're the doc to do it. So there's some myths out there that I was not even aware of. And as I've been speaking with you and Dr. Rowe, I'm like, oh, that I was told incorrectly. So let's go through some myths that people think using ozone, and let's lay it out what is really the fact, right? So one is that ozone therapy and vitamin C are not a good combo to take at the same time. And I want you to address that.
Well, starting in 1989, I told you I had a vitamin C and chelation therapy center. And we were at the time following some work done by Robert Cathcart, an MD out in California. And we were using up to 200,000 milligrams, 200 gram vitamin C drips. That used to take as much as 5 to 7 hours. But commonly between 75 and 125,000 milligram drips. But I was not in touch with the rest of the ozone world. I lived in an ozone bubble here in New York. So I did not know there was a controversy over vitamin C and ozone. So we would actually alternate days to start with. One day they'd get ozone therapy, the next day they would get vitamin C therapy. Later on, I did work in the early 2000s with a very well-known doctor in functional medicine, Dr. Michael Schachter, an MD up here in New York, very well known for treating cancer. And we worked out a very simple system. They would get their ozone, and 30 minutes later, they could have their vitamin drip. The reason being that ozone is used up in about 10 minutes in your body. There's just so much work for it to do. But ozone, you have to realize, vitamin C, as you probably know and the listeners may not, is not a vitamin. It was just called that. It's really a coenzyme. And it's actually necessary in every cell of our body for virtually every cellular reaction in a healthy cell. And you couldn't live without adequate amounts of vitamin C beyond the amount that it takes, the 30 milligrams it may take to eliminate scurvy. So we need vitamin C. And in fact, all my patients are instructed to take vitamin C 5 or 6 times a day, every couple of hours while they're awake, as much as they can without causing an upset stomach. So it varies from person to person how much. And I believe that's one of the reasons why I probably don't get oxidative stress reactions, which is a concern with any oxidative therapy. Keeping in mind that ozone, while it is an oxidative process, acts more like a free radical scavenger, more like what antioxidants do, even though it's using an oxidative medicine. So it's a little bit interesting if you understand the chemistry, which I don't want to get too deep in case the listeners there aren't that keen on chemistry. But that's what it really does. So vitamin C and ozone were perfectly compatible. Now, I will admit, if you put vitamin C and ozone in a test tube, there'll be a negation. But why it doesn't work that way in the body is because our body is loaded with harmful organisms, for example. Scientific American magazine, June of 2012, cover story says, bacteria outnumber healthy cells in your body 10 to 1. Who's in control? We're supposed to have 3 trillion healthy cells in our body, which means they're claiming over 30 trillion bacteria. So ozone's got a lot of work to do to get rid of all these things. And if you take any one segment of blood, I don't care whether it's an ounce, 2 ounces, a pint, whatever you want, there's only so much virus, fungus, yeast, mold, bacteria in it. There's only so much medicine in it. There's only so much vitamin C in it. So while ozone may react with the vitamin C, there's very little of it that it's going to meet, and therefore it has very little effect. In fact, for that matter, it doesn't seem to have an effect, because we used to test it all the time, on pharmaceuticals or nutraceuticals. In other words, you're taking an antibiotic. Now think about that, a small little itty bitty pill that goes around your body doing all its work and its damage as well sometimes. Well, that's not a lot of medicine, but it does have a powerful effect on the body. Ozone is going to meet very little of that antibiotic, very little of your blood pressure pill, very little of everything, and therefore it's not going to have any negative effects with those things. The same thing goes for nutraceuticals, vitamins, minerals, herbs, supplements of all kinds, homeopathy. It won't meet enough of it to negate it, and that's why they work synergistically, or they don't get in the way of each other working.
Awesome. That was so simple. Thank you for explaining to us like that. That's fantastic. So they don't have to worry about that. Does that same hold true, the same fact that you had just mentioned about the IV vitamin C, if people take pills? Because typically they take pills, the vitamin C supplements, liposomal or whatever. Does it make a difference?
No, again, it doesn't matter. You can take anything you need to take currently, or anything you may suddenly need to take, nutraceutical or pharmaceutical, and it won't get in the way of the ozone working, and the ozone won't get in the way of it working. They'll work together, actually, if it's meant for the same purpose.
Okay, gotcha. So another myth that we have is that people often will say that they hear, and this has been going around quite a bit on the internet, is that ozone is dangerous to breathe in, and especially for the lungs, it irritates and could cause damage. So
well,
what do you say about that?
That's not a myth. That is a serious issue.
Okay.
Yeah, what happens is this. When we put ozone into you intravenously, your body has some sort of a signal that I don't know if that's been discovered or not biochemically. One day it will be. There's a lot of literature in other languages I can't read that gets eventually translated, and I learned then something that was known for a while. But it stimulates all your healthy cells to make those 4 antioxidant enzymes in abundant amounts that I mentioned earlier. And that's what prevents healthy cells from being damaged. But when you inhale it, you don't give your lung tissue ample time to protect itself against the ozone. Therefore, you can damage cells that way and destroy cells in your lungs if you inhale it directly. most of us in the ozone world are against the inhalation of ozone. There are a few that, there is a group that believes that if you filter it through olive oil first, then you can inhale the gas. According to my daughter, who graduated cum laude from Harvard in chemistry and graduated with her PhD from Berkeley, now works for Google developing a contact lens that can tell your blood sugar. And she's a pretty bright bright
I
child.
would say Harvard, Berkeley, Google. Yeah, that's all pretty big. Yeah.
She did the chemistry for me, and basically what comes out of the olive oil is gas. And the ozone gas may still have a harmful effect on your lungs that may not have been reported in the literature. There are absolutely no reported deaths anywhere in the world, by the way, from the use of direct IV ozone done by doctors professionally. There are 3 reported deaths from ozone being used by doctors using the MAH method, that major autohemotherapy. 1 here in the US and 2 in Europe. I don't believe it was the autohemotherapy that actually harmed them. It was their medical problem, but it was attributed to the autohemotherapy, unfortunately, even by our FDA here. But they didn't stop ozone therapy, and certainly none ever by the methods that we use in our office and clinic.
So appreciate that explanation, because people are a little bit concerned about it. And I agree with you about the olive oil. Now, what about like if people are using a ozone kit at home and you know how sometimes some of it escapes and you have that odor. Now, I typically tell them to use a fan, open the window, get some circulation in.
Excellent.
That's that, right? That little amount, as long as there's circulation in the air going on and the window is open, won't hurt them. Is that correct?
Yes, you're absolutely right. Inconsequential. Rectal insufflation can actually absorb some ozone into your blood. Vaginal insufflation is good for many vaginal problems: endometriosis, endometritis, fibroids. It'll get rid of small fibroids, herpes, HPV, candidiasis. It has a host of benefits for women vaginally, and my feeling is it should be used probably by women to prevent, just have healthy pap smears their whole life. They probably should be using it at least weekly just to prevent, you know, female issues down there. I think that would be very wise. One day it might be. Rectal insufflation, like I say, will not equal any IV ozone therapy in benefit, but it can help in many, move things ahead. You may read on the internet somebody cured their brain cancer with rectal insufflation. I believe it probably happened, but it's an ozone miracle. And don't bet your life on that it's going to happen for you, because miracles should be, by the definition, rare, few, and far between, not the common. But it can assist when you're doing direct IV in holding the status quo. Auricular insufflation is misunderstood. You can only absorb a small amount of gas very slowly into the inner ear, and there is no vascular apparatus in the inner ear that can really transmit the ozone around your body in an appreciable amount. It is great for outer ear infections of all kinds. It's great to help close a perforated eardrum and get into the inner ear through the perforated eardrum for problems like that. But it should be done, like you said, in a room with open ventilation, with a fan blowing away the gas away from your nose. Because remember, ozone's heavier than air, so it'll come out of the outer ear and into your nose. And the absorption in the lungs is probably why it fixed a lot of problems with auricular insufflation that have been claimed, other than ear problems. So it's very good. I mean, we've seen a host of eye problems. We've seen patients with macular degeneration stop in its tracks, early onset reverse, diabetic retinopathy.
So hold on, with the eyes, how would the application of ozone be used?
Intravenously.
Okay, so everything intravenously can be helping with that. Okay, great. So because our time is winding down, Doc, one last part here. A lot of people are concerned about ozone coming out through the skin and saying, well, see, the skin is going to get a rash, and I don't want the rash, so I'm not going to use ozone, right? That is one issue that, has been going around as well. And we need to say, first of all, is it fact or myth that you always get a rash when you're doing ozone therapy?
Okay, you should never get a rash doing ozone therapy. If you're
Oh,
getting a rash doing ozone therapy, it is my opinion you may be allergic or sensitive to ozone because it's still a medicine. And we've only had 8 cases of that occur in all the years I've been doing this. But it's used in an ozone sauna. So it's directly affecting the skin. And you can absorb a small amount into your body that way, but a very small amount. But it's wonderful for skin problems, amazing for skin problems. A method using that and combining a lot of other things is a HOCAT machine, HOCATT. And that combines a whole bunch of different therapies in one big gigantic unit. I had it done to me at Dr. Rowan's office. And it does, of course, it puts ozone into the steam that's in there. And again, helping affect your skin and help your and your health without breathing it in. That's the most important thing. So no, it's very healthy for skin. It's amazingly healthy for skin. And we even have organic ozonated oils that we use for many skin problems. I treat wounds all the time, diabetic gangrene, decubitus ulcers, wounds of all kinds with a combination of direct IV ozone, 10 pass if we can, and the ozonated ozone injections right into the tissue for skin problems. Wounds, bites, burns, stings. We go right into those areas with the gas, and we destroy the toxins right away, the biofilm and whatever that's stopping a wound or an ulcer from healing. And we close ulcers by all sorts of ulcers, leg ulcers down, venous ulcers, all the time in unbelievably fast amounts of time. I mean, the application is so amazing. It has so many different ways of using it to get great results.
Yeah, that's really awesome. So we had some Mythbusters and we got the real facts on some of these applications. People just don't know. And so, you know, we can't argue with you of having 265,000 treatments. You've seen it all just about. I mean, there's so much out there and you've really set the record straight. So thank you so much, Doc. If they want more information, they go to your website, which is?
My website is ozonedoctor.net, OZONE. DOCTOR.net, ozonedoctor.net to locate me. But one way or another, because it seems to have been published on the internet, and I answer calls all the time, they can call me on my cell phone and have their questions answered. The number to call is 516-967-1009.
You might have to shut your phone down after this because thousands of people will now call you and say, Doc, so funny. Get ready. You put it out there, so watch out, Doc.
That's okay. And it's my pleasure to refer to all the doctors that I've trained from around the country.
Exactly. You and Doc Rowan have trained a lot of people all over the world. And so I know that, I don't know if it's on your site as well, but I know Doc Rowan definitely has, Dr. Schallenberg, lots of docs all over the world, not as much as we would like to see, but hopefully more soon, so that people could call and say, you know, the docs in their local area that they could call to get treatment. And now that they're seeing this information, they will know exactly what to ask for. They're going to be more knowledgeable. And it's because of people like you who are setting the record straight. And we really appreciate that.
I thank you very much for all those kind words.
Yeah, absolutely. Thank you so much. And my viewers, thank you for being here on the Ozone Therapy Summit. We appreciate you guys. Stay tuned. We've got lots more docs coming up. We have veterinarians, biological dentists, more medical docs, all talking about the value of ozone therapy in healing. So we'll see you on the next episode.